So, Dr. Nitika, this is the answer that you gave on the physical part. Yeah. Now, coming on the emotional and the mental part of the mother, how can she be peaceful? What are the ways with which she can, connect with the baby? What are the ways with which she can, maintain that peace, that calmness in her mind while this 9-month period?
See, first with the awareness that I am carrying a baby within me. And I want that baby to be very, very healthy. So if you're working with that awareness all through, then you need to keep creating and devise methods for yourself that how can you have less of reactions. What do we mean by being peaceful? See, if I have to, supposing if I just take myself as a doctor and I have to do a very long surgery today. If I have to do a very long surgery today, I am a little anxious and stressed in my mind anyways, because it's something which is little different. But in spite of being a little more anxious than a normal day I would be, I am peaceful. Will that enhance my performance or will that deplete my performance? Enhance my performance. So how? Because I am aware. So I purposefully, even if things don't fall in that place, even if there are complications during the process I maintain my peace of mind with the awareness that I
am carrying a baby.
So that awareness is important, and that is why, how will you have that awareness? I always tell all my mothers, please always maintain a connection with your baby. Keep creating your baby visually. On the YouTube you can see what a 4-week-old baby looks like, what a 8-week-old baby looks like, what a 13-weeker looks like. Nowadays, these are things science has given us. Why? To help us. It's giving information, you convert it to knowledge with your doctor and you visualize your child. In fact, whenever you are eating something, whenever you are drinking something, with that awareness that my baby is becoming healthy.
Like with an affirmation that you're eating for 2, you're breathing for 2.
Fine, yes, that's a very beautiful thing. Because once you have that awareness is clear within you that yes, I am carrying a baby, automatically these virtues you will keep practicing, because if you want your baby to be happy, to be peaceful, you need to do that. And to do that you have to be aware, because that's the motivation for today. And once you are going to practice all these virtues, of which we do give you little tools, and the first and foremost tool which we are giving you is knowledge. Why should I be peaceful? If today I am peaceful, my body is in good harmony. All my cells are working well. All my organ systems are working well. See, very simple, you just tell me, forget pregnancy. As a doctor, I'll ask you, if you want to go to an important project and you are having high fever, you take a Crocin tablet, your fever will reduce for 4 hours. And you will go, if it's important for you, you will go or you will not go?
I will.
You will go. But today in the morning, you are just not feeling good. You had a fight at home, there is some disharmony, there was some stress or anxiety which was playing.
I'll be avoiding the project.
Whole night you couldn't sleep. There is an emotional chaos which you are dealing with. Any medicine will help you in that time?
I don't think so.
But you are not having fever. But will you go for your assignment?
Probably I won't be able to make it up.
And if you go also, will you be able to perform that well?
Take out my productivity to that level.
Yes. So that is the similar thing will apply everywhere, even in pregnancy. If you physically, your body is actually adapting, nature is doing it for you. And you are well aware of those physical symptoms also. But the emotional aspect also you need to be very clear on, because if emotionally you are not that fit, you will not be able to deliver in the assignment, so you will not be able to deliver here also in that capacity. So you have to be.
That is really convincing, that whatever we feel, or if we are feeling completely confident, if we are feeling completely happy, if we are feeling completely peaceful from our inner wisdom, then we can actually deliver the same to the other person as well. And Dr. Sobti, as we talked about the vibration in our last episode, again I would like to comment on that it creates a beautiful vibration. Even if we are happy, we create a positive vibration. If we are sad, we will create that negative vibration for our baby. So, how exactly, again coming on to our question, what are the ways with which we can connect to our baby? Like any meditation is a way, or any, like what are the small little ways
See,
with
for
which?
that, first and foremost, we need to know a little bit knowledge we need to have about the development of the baby. Like when does the baby starts to taste? When does the baby starts to see? When does the baby starts to move?
Okay.
You know, there was a very interesting study which I came across when I was going through this perinatal psychology, birth psychology, and a lot of scientists, believe me, are doing a lot of very, very good work on this. That is giving us so much of reassurance, because they have laid down facts on which today we come and we give something like this as a project, because we are clear that this has shown scientific results. There is in a twin mothers, you know, they did an experiment, and in twins in which there was a dividing membrane between two twins. They were non-identical twins, you know. They were fraternal twins. One is identical twin in which there is no intertwining membrane. But in fraternal twins, they have different babies. From two different eggs, sperms come, unite, zygote is formed, and two different babies are formed, but in the same sac or womb. You know, they did a beautiful photography in which they said that by the end of the 12th, 11th week, third month, just before ending, they were trying to touch their hands on the membrane. That much is the connect which that life inside at 11 weeks is feeling, and we are not even aware till then. We are only worried about nausea and vomiting by then. That we are just having vomiting, we are just having nausea, I am feeling tired, I can't do my daily course. I mean, we don't even actually start to understand that so much has happened inside. You know, there are certain tests which a mother needs to undergo because of some abnormalities, if she is elderly, or if the ultrasound is showing some abnormal report. So we need to test the water around the baby for that entire genetic analysis, and that is known as an amniocentesis. And that's a very huge study which was done, because many mothers undergo this amniocentesis of taking a little water around the baby and sending it for testing, for the betterment of the baby, of course. You know what they actually found? They found that the moment they pricked the womb, the heartbeat of the baby rose. So that much is sensitized is the baby's system only at 14 to 15 weeks. If somebody would give me a prick today, I will also have a higher heartbeat, no? So baby is not being pricked. Only the water around the baby is being taken. Still the baby's cardiovascular system is so sensitive. So if that needle can cause so much of sensitivity, will our screaming not cause it? Is it not clear?
Definitely it will.
So that's actually the entire thing which we want to just take it through this project. We'll go one by one over a few aspects and then keep clearing. Like we discussed in this, the nausea and the vomiting, which is very, very common, because that is something which I feel mothers actually cannot enjoy that first 3 months because of this. But once they have the knowledge, it becomes easier. And we'll also share information on diet. That's also very important. We'll have a dietitian with us also giving us an expert opinion on it. So everything, I think, if we take them one after the other, it's going to make our patients, you know, more in control of their pregnancy and more happily and more clear on, yes, they have to now create a virtue baby.